here's your host, health and wellness correspondent, Lee Kelso.
Hey, good morning. So glad to have you with us once again. Happy to be with you, and a busy Saturday morning for everybody. I'm glad you made time for us. We are going to kick things off today with Gregg Russell, pharmacist and clinical nutritionist, founder of Fort Wayne Custom RX, the gentleman that my wife and I both trust to prepare our hormone supplements, and appreciate you being with us this morning.
Oh, good morning. Happy Thanksgiving to everybody.
Indeed. A little bit delayed for everybody. We've all had some kind of change in our schedule. I know your family's gathering later today. So
all outdoors.
All outdoors.
Yeah, so isn't that going to be fun?
Yeah. That's the smart thing to do. Boy, we're going to focus on how some things have changed, some latest studies on COVID, and what we know about preparing and strengthening our bodies to do battle with this virus. And one of the important things is you came across a study recently that confirms what you and I have talked about really since the start of this thing, and that is vitamin D3 is awfully important.
Yeah, vitamin D is huge. Study was written September 3rd in JAMA. So, not, again, pretty reputable.
The Journal of the American Medical
Association. This is a pretty important magazine. And basically it's a study that was kind of unique that the University of Chicago Medical School did. Basically, they went through and they categorized people's vitamin D levels. They actually measured their vitamin D levels. And they didn't measure it right before they were hospitalized, but they measured it. They went back and looked in their records and saw what their vitamin D levels had been over the course of a year. And then they went through and they stratified them according to their symptoms, and they took a look, and what they found, just to kind of dumb it all down here, was that basically if you didn't have adequate vitamin D levels, you had a 1.77 time increase in testing positive for COVID.
That's huge. That's
huge.
That's almost double.
Yeah, and the other thing that was pretty remarkable is the actual level that they used for baseline for that vitamin D was actually pretty low. Mm-hmm. So then you have to kind of surmise, well, what would happen if their vitamin D level was a little bit higher? Would it be 3 or 4 times better? So I think that's really interesting.
Yeah. So we know now that vitamin D is generated predominantly through sun exposure to the skin, which, of course, around here, none of us get enough of in the winter. Hard to get it in foods. It's apparent in milk products. Many people not drinking milk these days. Salmon and other fatty fish are often a source of vitamin D, but not enough people are eating enough of that product.
You eat salmon every couple of days. It's pretty hard to do.
Yeah,
it's pretty expensive, too.
So you really have to supplement. Otherwise, you're going to be deficient.
Yeah, unfortunately, up here, we find that most of our patients are needing between 2,000 and 5,000 IU units per day. Now, of course, that's not everybody, but a vast majority of patients need some form of vitamin D being supplemented.
Well, I'll just give you my body as an example. So since you and I have started working together, you've got me educated, and now I'm taking 4,000 units of vitamin D a day. And I'm now at 49. My blood level is at 49. And 50 is kind of the target, right?
50 is our target. So you're basically there,
right,
I would say.
But it takes 4,000 units a day to keep me there. Yeah.
Right. Yeah. The amazing thing about this hormone is, most of us don't have jobs where we work outdoors. We're not going to get sunlight. And so even myself today, I'm going to get out for a few hours, but most of the week, 8 a.m. to 6 p.m., I'm indoors. And at this time of the year, there's not much sunlight before 8 or after 6.
Yeah. So we just need to be aware of that and take advantage of the fact that vitamin D is widely available. But, as I've learned from working with you over the months, you just don't know where any of these supplements are coming from. And is anybody looking at what's really inside that little gel cap?
Yeah, well, that's a great question. And we know that a lot of products that are coming off Amazon, for example, are coming from inferior sources. We've talked in the past about, the foreign chemicals coming out of foreign countries, especially China and India. And some of those products are really substandard. They may have D3, they may have something else mixed with it, but the point is, you got to buy from reputable people. If you're going to spend your money on good quality products.
And is it that much more expensive to buy high quality D versus whatever I'm going to pick up on the discount shelf at wherever I'm shopping?
Yeah, not really. Vitamin D3s shouldn't be very expensive, and for example, we have vitamin D drops or 2,000 units per IU, and I think it's like $30, but that's enough for like a year and a half. for most people.
Yeah.
Yeah, so it's not expensive.
Well worth doing.
Yeah,
and, of course, a lot of other benefits to as Rick mentioned just a moment ago. You've got, Rob mentioned just a moment ago, you've got bone density issues that it helps, and there's a lot, even in terms of mental acuity and sharpness and focus is associated with vitamin D.
Vitamin D3 is involved in so many of our body processes that, we've noticed, for example, correlations between patients with type 2 diabetes having low vitamin D levels. Mm-hmm. And there's a whole thought about that it affects that insulin receptor that affects insulin resistance, which we've talked about in the past too. So vitamin D3 just is huge, and especially going into these winter months, you can't disregard it. That just has to be in everybody's medicine cabinet right now. And
it takes time. It's nothing that's going to change overnight. You really need to do this daily for a period of weeks to get your blood levels up.
That's right. It's it's considered a fat soluble vitamin. So your body's got to make it. It's got to absorb it, and then it's got to store it. So it's got to store it for those rainy days.
And that brings us to the potential, though, of pulse dosing when you are sick. Some people say it's appropriate to take high doses of vitamin D. What's the science tell us about that?
Yeah, it looks like what happens is vitamin D3 is involved in the two forms of immunity, the innate and the acquired. And when you pulse dose it high, it has a better effect on what they call the Treg cells, so here I'm exposed to this virus, and I need my immune system to get up to speed quickly, because I don't want to get overwhelmed. We talk about the cytokine storm, that which really is the precipitating of the forest fire. It's a spark that turns into a forest fire very quickly. Right. So you want your immune system to pour water on that real quick. And when you take a bolus dose of vitamin D3, it appears that it turns on those Treg cells, which is what balances that immune process. And so again, you don't want to take high dose D3 every single day. But, it's not uncommon. One protocol that I've seen is 25,000 units daily for 3 days. I typically recommend for the common cold or the flu season before COVID, doing 50,000 units a day for 3 days. Now, there are exceptions to that, of course. We talked about that with people that have parathyroid issues or people that have severe renal issues where they can't control their calcium or they have hypercalcemia. So not everybody should take that. But, again, that's something you can discuss with your doctor. When you go in for your regular checkup, say, hey, if I do get the flu, would it be okay to dose 50,000 units a day for 3 days? I've seen it work.
Yeah, that's it feels odd to I still have some kind of a flu or a cold or something going on in me, and it feels odd to pour 10 of those little capsules into your hand at one time and swallow them all, but it's a good idea.
Well, they do make a 50,000 unit capsule that's actually over the counter. So I keep one in my medicine cabinet. It's a 10-pack. Mm-hmm. I even keep it in my little briefcase. And, if I start feeling something coming on, I get on it. It's just better to get on it than let it get seated.
And that is your pharmacist telling you what he's doing in his personal care. So that tells me a lot as well. Mm-hmm. Okay, so what are some of the other things we can do to dial up our immune system and get it tuned up and ready to go?
Yeah. Well, again, right now zinc is the other mineral. Zinc's really important. It turns a lot of enzymes on in your body, but it also really is, again, another very potent component of the immune system. So what we know is the zinc actually inhibits the messenger RNA from duplicating in the virus. So getting that zinc into your cell plays a really, really important action. And so we all know that there's a lot of products marketed for zinc, like the zinc lozenges. Well, the reason why that it became so popular was actual studies confirmed that zinc had an effect, especially on respiratory infections, especially sinus and type infections. And so, but again, I don't necessarily believe you have to have a lozenge. I think you could just take a dose of 30 to 60 milligrams, typically is what's recommended for adults, 15 to 30 for children or teenagers.
So it's a single capsule once a day.
Yep.
And is there a different type of zinc? I mean, there's zinc sulfate and there's other things on the shelf that can be confusing. Yeah. Does it matter?
Salts always matter when it comes to different minerals, and that they will tell you how fast something actually breaks down. So, for example, zinc chloride, you take 220 milligrams to get I believe about 50 milligrams of zinc absorbed. And so that's kind of one of the standards that you can buy. So that tells you a lot of that zinc is not really dissolving, or there are a lot of it's in the chloride form. There are other forms. Zinc biglycinate is a very absorbable form of zinc. And that product is, typically 15 to 30 milligrams. It absorbs much better. And that's one I use. Now, why does that matter? If you're taking a large mineral in a salt form, sometimes your gut has to work pretty hard. And if you've got the flu, the last thing you want is your gut to be working hard to be breaking things up, right?
Yeah, exactly,
so that can make a difference.
Okay, zinc, what was that again?
Biglycinate.
Biglycinate.
Basically, it's what we call a chelated zinc molecule that has a protein wrapped around it, and it kind of disguises it so it can get into the stomach, and the stomach then uses this system called active transport to help pull that protein and that zinc out of the intestinal tract and into your bloodstream.
I just caught a glimpse at the clock. We need to take a break, and then we're going to come back. We're going to talk about some things you can do if you have COVID. If you think you're positive, what are some steps that you can take at home to help push you forward and toward better health? So we're going to do that with Gregg Russell, pharmacist and clinical nutritionist from Fort Wayne Custom RX, as we continue here on the HealthCall Live Radio Hour on WOWO. And let me repeat that phone number. If you have a question for Gregg Russell, pharmacist and founder of Fort Wayne Custom RX, it's 800-333-1190 or 447-1190. Also watching the text screen at 46862. Hey, today is Small Business Saturday. You are participating. Tell me what you're offering.
Yeah, well, everything in our store that's considered a nutritional supplement, which is just about 90% of what we have out front, is on sale. It's 10% off today. So a lot of our longtime customers look forward to this day every year. They come in, but we are only open to one today.
Okay, and that's 425 East DuPont Road at Fort Wayne Custom RX.
And then on Monday, just to let you know, if you order off the internet, we also are offering 10%. Oh. So you can go to our web store at fwcustomrx.com and order that way, and then you would know we will pick those supplements for you and make sure you get that quality D3 that you need.
Yeah, that is just so important. Yeah. So let's talk about what happens then once I actually think I have an active infection. Now what are the products that I need to be paying attention to? Okay,
so we talked about loading the D3. That would be certainly step one. Another product that, again, getting right back to the simple vitamins, it's amazing how, food was put on this earth with vitamins for us to use, but if we give a large dose of a vitamin, that it can do marvelous things. Of course, you can get toxic on vitamins too, so you have to be careful. So one of the things that we like is vitamin A. Vitamin A is, again, another vital vitamin for the immune system. It's important for the digestive tract. And we usually do is we give 25,000 units once a day for 3 days. Now, there's a caveat on that. The easiest way to do it is with a vitamin A drop. There are about 5,000 units per drop, and the FDA is changing the labeling on that, so you might need some help selecting a vitamin A product because now they're changing it to micrograms, RAEs, and that's very difficult for people to understand. But anyway, we can help with that. So it's 5,000 units typically per drop, so 5 drops, which is easy to do. Now, there's one person that can't take that, though, and that is pregnant women. Cannot take that much vitamin A at a time. The maximum for them is 10,000 units a day.
So vitamin A is for not only COVID, but what else? The flu, just kind of anything?
Yeah, basically, again, it's important for your whole immune system. Obviously, vitamin A, now there's vitamin A and there's beta-carotene, so we're talking about the vitamin A form, which is the fat-soluble form. It's also the form that we use for vision. Our eyes use a lot of vitamin A. So it's a major antioxidant, too, because it's in there to help protect the eyes from the sunlight that you get.
Okay. I've not studied vitamin A very much. I'm going to have to go back and revisit that. That's interesting. Okay.
So that's a good one to keep, too. So once we get past that, we start thinking about the herbals and the mushrooms. Okay. So, and another antioxidant called quercetin. So I'll start with the mushrooms. The one that has the most research is beta-glucan. And beta-glucan, again, is a product that's a yeast that has been shown to it's basically been shown to affect the immune system on what they call the B cells and of your immune system, gets them wired and ready and prepared. And so there's a product that I like that's called Home Immune, and we actually have it in our brand now. It's called Immune Defense, which is 10% less than the Home Immune. Everyday pricing, 10% less. So we've we've paired up with the manufacturer to get the exact same product. And what's nice about that product is, again, I tell people it's kind of like a gun. You're you're cocking the trigger. You're getting your immune system ready to fire. And then the other products you want to use are probably combination products, like that have elderberry and astragalus, Andrographis, echinacea. These are all herbs that then cause the immune system to fire. Okay, so a lot of these are things that we've used for respiratory infections in the first place, for sinus infections, colds, and things like that. They help with those symptoms. So again, daily we take the whole immune, or the beta-glucan, the immune defense, and then once we have the infection, we take something like the immune support, and we ramp that up, and usually we take 2 capsules twice a day of that product. And I like that product, again, because it's just trying to mobilize your whole defense system at one time. It's coordinating everything to really try to prevent that virus from replicating.
Yeah, and that whole issue of viral replication is huge,
right,
because obviously the more virus is happening in your body, the more your own immune system is put under stress, and then you get into that whole cycle.
You get into that cytokine storm, you get into the coagulation issues and the respiratory issues. It's really rough stuff.
So you just mentioned coagulation, which is really important. One of the factors that they think is going on in this disease is it is a respiratory infection, but it's also infecting the blood system, and that there's a lot of coagulation that's happening. Your blood just becomes thicker, and you get this micro clotting, which they think is damaging lots of organ systems. And there is a doctor, a group of physicians out of Baylor Medical School that are recommending aspirin therapy as well. Are you on board with this idea?
Yeah, I think it makes perfect sense. You know, aspirin's a double-edged sword, as we've talked about in the past. You know, patients that have some kind of a stomach ulcer or duodenal ulcer, that's like throwing gasoline on a fire for them. But and then there's been some studies that looked about using aspirin as a something to be used for preventing strokes and cardiovascular issues, and some of those are really mixed. In fact, they're confusing even for healthcare professionals, and some patients have been on aspirin that maybe shouldn't have been on aspirin, and they actually have higher risks of getting ulcers later on. But in this type of crisis, you know, I'd have a bottle of baby aspirin too. So if I thought that maybe I was starting to really feel ill, I might start popping it, because it is an antiplatelet. And as long as you're not taking it for large amounts of time, I think the risks are fairly low for most of us. So
you said the baby aspirin, 81 milligrams is what was recommended in that protocol.
Yeah.
You know what? And I'm I'll just take what I have in the cabinet and break it in half. So that's 325 is a typical aspirin tablet. If I break it in half, I'm doing 160.
Yeah.
Am I risking anything by going that way?
Yeah. You know, we now know that the antiplatelet effects are better at the lower doses typically.
So more is not better.
More is not better.
So break that into a quarter.
Maybe break it into a quarter, yeah. Get yourself a pill splitter.
Yeah.
If you're going to do that.
Well, yeah, because and baby aspirin as opposed to the low-dose aspirin, does it really matter?
Well, yeah. The baby, that was a misnomer. I should say low-dose aspirin. We're not calling it baby aspirin anymore. But the 81 milligrams, the baby aspirin is like a chewable aspirin, and then you can get an 81 milligram that's coated, and sometimes that's more tolerable for patients with GI issues.
Okay, very good. We're down to about a minute left, if you can believe that.
Wow.
Anything else you want to hit us with before you take off?
Well, I think something for us just to take a step back and remember is the long-term sequelae that's starting. That's what's really scary.
Yeah.
There was a study that showed, athletes that were outpatient that ended up getting COVID. They weren't hospitalized. They went and they checked their heart enzymes later on, and they realized that there were some abnormalities, and just about most of them. So, we don't know what the long-term effects are. So I guess the point is we got to stay tuned and pay attention.
Yeah. So we hope we've helped you with that today. That is Gregg Russell, the pharmacist at Fort Wayne Custom RX, founder of Fort Wayne Custom RX, and a regular guest here on our program. I'm so happy to have you, and I'll invite you, if you want, you can stick around in the next half hour. Dr. Jamie Rutland is going to join us. If you need to run to go take care of Thanksgiving stuff, I understand that as well. But appreciate you being here.
Thank you, Lee.